Hi, my name is Jordan Harding, and I'm going to be showing you the manual muscle test for the serratus anterior muscle. To start off, we want our patient seated in a good neutral seated posture, good posture position. I'm going to come on this side. We'll start off with the left arm. So to get the arm in position, we want to bring them into about 120 degrees of shoulder flexion. I'm also going to have her internally rotate her shoulder, keeping the elbow straight. And we want to kind of feel back here on the lateral border of the trunk. We want to feel for that inferior angle of the scapula. And we want to see if it's trying about to the midline of the trunk. So again, a little bit of protraction there, and I can feel that inferior scapula right there, kind of at the midline. You can go ahead and relax for a second. So the serratus anterior, one of its jobs is a little bit of protraction of the shoulder complex, as well as downward rotation, depending on the fibers we're looking at. So again, this is why we want them in a flexed, internally rotated, and protracted, because the force that we're going to place is going to be a downward force, as well as we're going to put a little pressure on that inferior angle and try to push them into downward rotation. So go ahead and keep that elbow straight, Kelly. We're going to hold this for 4 seconds and hold. Okay, I gave her a 3 on that, no compensation, and she was strong through the motion. So again, we'll come on this side. I'm going to try and come from behind over here. So again, about 120 degrees of shoulder flexion. We're rotating there. We want to make sure we're not seeing any compensation of an elevated shoulder here. Elbow straight, no compensation going on there. Again, I'm going to apply a force downward and a force pushing her scapula in a downward rotation. And go ahead and hold for 4 seconds, Kelly. And again, I would grade her a 3 on that. And that is the manual muscle test of the serratus anterior.